One good news I want to share with you. Today, one of my doctor, Dr. Princey, she has got selected in UPSC CMS.
Okay.
So I'm going to ask you questions which were asked on 8th of December by our medical corps. The first question is epistaxis. Speak on epistaxis.
Okay, sir. Epistaxis is the anterior nasal septal bleeding, which mainly caused due to the superficial blood supply of the nasal septum, which causes unprovocated bleeding, mostly in a hypertensive patient. 90% it is provocated by the finger prick. The management of epistaxis is just pinch the nose and forward bending till it stops the bleed. Just wait for 10 to 15 minutes for bleed to stop. If it's not stopping, then just then again for 10 to 15 minutes, blow the nose and bend forward. If it's not stopping, then the next management is surgical management to see for the any bleeding vessel and cauterize there.
Okay. What are the danger signs of head injury?
Okay, danger sign of head injury when the patient complains of severe headache, loss of consciousness, more than 2 episodes of vomiting. Patients complain of convulsions and seizures. Also, when the GCS of the patient is not improving for more than 2 hours. Pupil dilatation is also one of the danger signs for intracranial hemorrhage bleed.
Okay, pneumothorax.
Okay, sure, sir. Pneumothorax is the emergency condition which can be caused due to the air in the pleural cavity, which compressing the lungs and other pleura and causes the compression of the lung, due to which the patient present with the sudden distress respiratory symptoms and circulatory symptoms too. Because of compression of the lungs and presence of air in a pleural cavity, it compresses the lung, which causes indirect compression of the heart and causes the decrease in cardiac output. So patient present with the circulatory disturbances, also with the respiratory disturbances. The main medical management for the pneumothorax emergency, it is thoracocentesis, which is done in the fifth intercostal space, mid-clavicular line. And the definitive management for the given condition is intercostal tube drainage, which is done in a triangle of safety.
Okay. One good news I want to share with you. Today, one of my doctor, Dr. Princey, she has got selected in UPSC CMS.
Okay.
She gave me this news in the morning only. And very
Yes,
nice
sir.
student. Really, she was very active every time and practiced very well.
Yes, sir. Actually, I have also filled in the form of UPSC CME, but I couldn't go to the exam.
Okay.
I missed that opportunity.
Okay. There would be an opportunity for CAPF also later in February, I think, maybe. So that time, but one thing is that AMC first priority hours. But any other, if want to ask you, then you can share up with them about CAPF. That is also good.
Yes, sir.
Okay, my next question, which was asked on 8th of December, hemothorax.
Okay. Yes, sir. Hemothorax is also a medical emergency in which blood is present in the pleural space, which is mainly due to blood is present around the lungs, which is mainly due to the injury to the lungs or injury to the heart. Hemothorax is one of the serious condition which can also be occurred due to rupture of aorta, causing massive hemorrhage in the pleural thorax cavity. The main management for this is a pleural cardiocentesis, in which the blood can be removed in the second intercostal space, mid-clavicular line, sir. Even 5 to 10 ml of the blood removal can improve the patient symptomatically drastically.
Okay. Cholecystitis.
Cholecystitis.
Yes.
Okay, sir. Sure, sir. Cholecystitis is the condition in which inflammation of the common biliary duct is happening, which can be caused due to intrahepatic cause or extrahepatic cause. Extrahepatic cause, it can be the bacterial spread from pancreas or other inflammatory conditions in the intestine or bowel, which mainly causes inflammation of the common bile duct, which causes stasis of the bile, causing patient symptomatically present with the fever, nausea, vomiting, and jaundice, sir.
Okay. Appendicitis.
Okay, sure, sir. Appendicitis is a condition in which there is an inflammation of the appendix, which can be caused due to various reasons. One of these reasons can be a bacterial cause, which are present, the bacterial origin which are present in the intestinal lumen. It can be also due to the fecolith contamination or food obstruction, which causes accumulation of bacteria in the appendix and causes inflammation of appendicitis. It is the most common right-sided inguinal region, right-sided right-sided abdominal pain, causing severe pain. Patient presented with the symptoms of fever, nausea, vomiting, and right-sided pain, right-sided abdominal pain.
Okay. One question more. ADS, acquired demyelinating syndrome.
Acquired demyelinating syndrome.
Yes.
Yes, sir. I
It
have
is
to read
related
up
to
on
central
this.
nervous system.
Okay.
Do you want to know what it is? An acute onset
Yes,
of
sir.
inflammatory demyelination of the central nervous system is called ADS. ADS.
Okay.
This question was also asked yesterday. Okay.
Sir.
Cold injuries, frostbite,
Okay, sir.
chilblains.
Yes, sir. Yes, sir. Cold injuries are of two types, sir. It may be caused due to a dry cold and also the moist cold. The injuries most commonly caused due to dry cold is a frostbite, sir. Cold injuries are mostly due to when negative temperature is present. Mostly, it causes the crystallization of the fluid in the body area. That particular body area causes the injury to that area, which may be blisters, blister formation, or can be a necrosis of that area. The main treatment for this condition is the rewarming, sir. Okay, and the next injury is a cold injury, which is due to moisture. It's also called as trench foot.
Yes.
When the part is immersed in a very cold temperature, sir, or for more than, matlab, that the main cause for this condition is a venous stasis. Blood when gets stasis in that particular part, which get inflamed and causes pain, sir. The main treatment for this condition is a rewarming, but it's the not sudden rewarming. It's just a process of rewarming in a stepwise rewarming.
Now, if I ask
Yes.
you about dog bite and snake bite, very easy topic for you. I don't think
Yes.
you need to practice. Next, what is grievous hurt?
Okay, sure, sir. Grievous hurt is a condition in which, sorry, grievous hurt is a condition in which a person hurts another person, which causes disfigurement of the figure or which causes a bone fracture.
Okay.
Or bone fracture or disfigurement of figure, or causes permanent loss of function of that particular organ. These injuries are included in the grievous hurt, sir.
Okay. Grade 3 dog bite management.
Okay, sir. Sure, sir. Grade 3 dog bite management is when a dog bites and the injuries are lacerations,
Okay.
and when blood oozes from the injury. The main management for this is a rabies vaccine, and rabies immunoglobulin should be administered, sir, and along with it, TT vaccine should be given, sir.
Okay.
And wound management, is clean with the fresh water. Yes, sir. And
How
for
to-
the laceration, minimal sutures should be taken.
Okay. They are saying how to give IG injection.
Okay, sure, sir. IG injection is a immunoglobulin injection which can be given by calculating the total dose of immunoglobulin. It is calculated by the formula 4 into body weight into. Actually, I couldn't recollect that formula. I will be sure by it. Then by calculating the total dose, half of dose is given around the lesion. Maximum dose is given around the lesion, and the remaining dose given in the buttocks, half dose is given in the buttocks, and the large quantity of the dose is given around the lesion. Yes, sir.
ARV dose regimen.
ARV dose regimen. Okay, sir. ARV doses are given a pre-prophylaxis dose and post-prophylaxis dose. In the pre-prophylaxis dose, we are given in a 3 doses. 1 day, the dose schedule 1, 3 and 7 days. Sorry, 1, 7 and 21 days. And for the post-exposure prophylaxis, we are given in a 5 days, sir. 0, 3, 7, 21 and 48 days.
Okay. One question from board 3. Difference between isolation and quarantine.
Okay, sir. Sure, sir. Isolation is the procedure when the person gets separated from the other person. The person which are separated is having a disease and symptom of the disease. It's called isolation. Quarantine is the procedure for separating the person who are in a close contact with the person, but they are the healthy individuals.
Most common type of snake found in your state.
Most commonly, snakes are non-poisonous snakes, sir. But among the rest, snakes can be a viper. Viper snakes are most common, sir.
What kind of toxicity does it cause?
Okay, it mainly causes the viper causes vascular toxicity, which causes blood loss, sir, which disturb the coagulation, and it continuously causes the bleeding complication. It can be a.
Please continue.
Yes, sir.
Yes, you continue.
It can be gum bleeding or nose bleeding or any kind of internal bleeding, sir. We are bleeding from the bite side also, or IV cannula side.
And snake bite management.
Okay, sir. Sure, sir. Snake bite can be of a 3 type: neuroparalytic snake, bleeding causing snakes, and musculoparalytic snake. Most common dangerous form is a neuroparalytic snake, which causes neuroparalysis of a respiratory system, causing the patient come with the respiratory distress, sir. The main management for this is atropine and neuroparalytic, and the improvement of neuroparalysis is done by neostigmine dose. For vascular toxic snake bite, it is the most commonly symptom is the bleeding from any side, external or internal. External side, it can be from the IV cannula side or bite side, or gum bleeding or nose bleeding. Internal bleeding can be internal, which cannot be seen through the eyes, but patient present with the decrease in blood pressure. So we can manage accordingly. The most important management for this snake bite is the ARV, sir. Anti-snake venom should be given according to the test, which is also called as whole blood coagulation test, in which for blood sample is taken and it kept for 20 minutes. If it's get coagulated, then it's absolutely normal. If it's not get coagulated, then anti-snake venom should be given in a dose of for the neuroparalytic and vasculotoxic person. It is given as 110 vials in a 1 liter of saline, normal saline, sir. It should also be TT injection also given with that. And before giving anti-snake venom, we have to test their sensitivity. If it's an emergency condition and there is no time for us to do a sensitivity testing, then should be ready with the 1 gram dose of adrenaline, if just in case if any anaphylaxis reaction is happening.
Okay. Clinical feature of compartment syndrome and DVT.
Okay, sure, sir. Okay, sure, sir. Compartment syndrome is a condition when the pressure inside the, if there is any injury happened, then it causes the pressure inside that organ to increases. It causes pain on a passive action. Just in case of DVT, it's mostly causes the pain in the calf muscles. When we flex the patient's leg passively, patient winces with the more pain. It's called as compartment syndrome when the compartment pressure is more than 30 mm of Hg, sir. The main treatment for the compartment syndrome is a fasciotomy, sir. Releases the muscles, releases the space by incising it, and releases the pressure.
Antibiotics in pregnancy.
Sir, I have to read upon this, sir.
Okay. What is your favorite subject and why?
So my favorite subject is obstetrics and gynecology.
Here one girl
Yes, sir,
is
because
in board 2. She is also saying obstetrician.
sir, actually, my friend suggested me to say the subject which you have a more grasp on,
Of
because
course.
they are 90% they are asking
They are
about
asking
that subject only.
topics are also good. Medicine and emergency topics also you can highlight. Quite good topics.
Yes.
Even obs-gyne is good. Okay, what are the common cases you saw in obs-gyne?
Okay, sir. Sure. Sir. Okay, sir. The most common cases I have seen is the obviously normal vaginal delivery, sir. The other cases I have seen are the abortion cases, and also the normal routine checkup, sir, for the ANC peoples.
Okay. Okay. Okay, tell about asthma.
Sorry, sir.
Asthma?
Okay, asthma. Asthma is a condition in which there is hyperresponsiveness of the airway, sir, which causes obstructive lesion to the lung, in which there is a no injury to, there is a only pathology for the air expiration, sir, which causes because of narrowing of the airways. Asthma management can be divided in a 3 types, sir. Is the intermittent asthma, mild type of asthma, and severe type of asthma. In the intermittent asthma, if the patient is having symptoms only during a season or during change in any type weather, sir, it's called intermittent asthma. Patient can be managed with small dose of inhaled corticosteroids plus short acting beta 2 agonist, sir. In the patient having mild symptoms, patient can be managed with the regular dose of inhaled corticosteroids plus long acting beta 2 agonist. And for the severe cases, patient can be managed with large dose of inhaled corticosteroids, long acting beta 2 agonist, and short acting bronchodilators, sir. And patient can be managed with short acting bronchodilators, that is salbutamol, for the acute exacerbation of asthma.
Okay. These many questions are enough, I think. Now we'll go with the medical portion, medical topics, which I will give you, and you prepare those. Okay, those are very compulsory.
Yes, sir.